As implants are becoming more and more a standard practice in our daily routine, I think the old standards for evaluating the success of the implants don't apply anymore. In the old days, an implant was a success if it was osseointegrating. Today that's not enough. We want to add more value to the implant besides become stable in the bone. So we want to mimic a lot of natural, not the natural behavior, but the natural look of a natural dentition. And that will be the responsible for the long run to achieve the success that we pretend on implant rehabilitation. And that's why the incorporation of materials like PEEK that can mimic better the behavior of a natural tooth will probably give us an advantage in the long time. I think that now we have the technology to try to look at the natural tooth, understand how the natural tooth behaves during function and also during parafunction, and try to imitate that and to transport that behavior into prosthetic rehabilitation. And here is much more important the rehabilitation over implants than rehabilitation over natural teeth, because the implants, they make a huge difference in that mechanical behavior. Implants are much more rigid than natural teeth. So when we want to reproduce the function, we have to understand that there's some flexibility that is necessary to add to our reconstruction. If it is the infrastructure, if it is the material of the crown, then we need to see the whole together as one and decide which is the best conjunction of materials to achieve the best behavior as possible. Minimizing the use of metal in dentistry is an old objective. I think today the use of metal is almost minimized to the use of implants, prosthetic screws, and abutments. Dentistry has composite materials, hybrid materials, ceramic materials. Also for prosthetic reconstruction, we have now the possibility of using PEEK and other materials of the same type, where before we could only use metal. I think metal was a necessary evil because in dentistry we are always dependent of the technology that exists in other areas, and we import that technology to dentistry. The metal started in a time in which the Industrial Revolution was on its apogee, and of course it was easy to import that technology to dentistry and allowed a huge evolution during the following years. The use of CAD/CAM technology allow us to use different types of materials. Materials not anymore made of metal, but made completely of ceramic, or in some cases hybrids. And with those materials we can substitute almost any metal still in use today. So I think it will disappear completely in the few years to come.